डॉक्टर प्रोफेसर विवेक गुप्ता, कार्डियोलॉजिस्ट, दिल्ली अपोलो हॉस्पिटल से। एक पेशेंट है जिनको अभी भी थोड़ी देर पहले मैंने बताया था कि इनको 2 बार चक्कर आया, हल्का से बेहोश हुए। इनको 2019 में स्टेंट लग चुके हैं। ही हैज रिसीव्ड स्टेंट इन 2019 वेयर एलईडी वाज लेफ्ट ऑन मेडिकल ट्रीटमेंट, फाउंड टू बी ऑफ समथिंग लाइक 60% स्टेनोसिस। आरसीए में 2 स्टेंट, देयर वर 2 स्टेंट्स इन आरसीए and 1 stent in left circumflex artery. So now we have done the angiography which revealed a very tight stenosis of 95% in RCA. We presume that this was possibly the cause of angina and sweating and possibly some dizziness, pre-syncope. So now we have done angioplasty. I'll tell you how. And we thought that pacemaker will not be required, but we took a preventive temporary pacemaker. So I'll show you some steps here and very quickly in 3 minutes that what we found in angiography and what we have done in angioplasty. And देखिए ये this is what we did. This is a temporary pacemaker we have done, and then we have done angiography. I took angiography only after temporary pacemaker, and you can see there is a stenosis of 60% in the right, in the circumflex artery, and then LED was seen, and LED has got you can see some significant stenosis in LED, which is about 80% or 70% eccentric stenosis here, and so this can lead to angina, and it can also, if it is a vulnerable plaque, it can lead to acute MI. So we don't want to leave this artery, and I would personally feel that sometime you can think that this is 70%, and sometimes it looks like 80%. So there is definitely stenosis here. And then the most important thing is that within the right coronary artery, right, we found 95% stenosis at the edge of the previous stent, and other 2 stents were okay. Mild stenosis here further. So we have done a quick decision of doing an angioplasty of the right. You see this is the wire, this is a balloon inflation, pre-dilatation, and then followed by a quick stenting 2.75 millimeter into 15 millimeter stent, and the final result is perfect. This is the final result. You can see the absolutely normal flow, and I am leaving this on medical treatment. Then similarly we did LED with the wire, put a pre-dilatation with a balloon, and then of course pre-dilatation, and then we wanted to avoid the diagonal branch, so we were a little cautious and putting a stent right after the diagonal branch. जो stent लगाया है हमने after diagonal branch लगाया, and the final result is perfect. 3 millimeter into 15 millimeter stent, and this is the balloon inflation, and this is what we have done, a perfect angioplasty. You can see Dr. Vivek Gupta from Apollo on 25th September 2025. Thank you very much.